A 45-year-old patient is admitted to the dental clinic with acute dental pain. The dentist found penetrating dental caries affecting the second mandibular molar tooth. Which of the following nerves would the dentist need to anesthetize to remove the caries in that tooth? Let's review the options. Regarding the lingual nerve, here you can see the lingual nerve in this dissection showing the infratemporal fossa from the inside, and you can see here the mandibular nerve giving rise to the lingual nerve. The lingual nerve is not related to the nerve supply of the teeth. As its name indicates, it supplies the tongue and it also supplies the lingual side of the gingiva but is not involved in the nerve supply of the teeth. Just posterior to the lingual nerve and also a branch of the mandibular division of the trigeminal nerve is the inferior alveolar nerve. Here the inferior alveolar nerve disappears as it passes into the mandible through the mandibular foramen. But before doing so, it gives this branch. This is the nerve to mylohyoid. This nerve to mylohyoid is a motor branch and it supplies, as you can see here, the anterior belly of digastric and mylohyoid. So the mylohyoid nerve that is present in option E is false. Here you can see another branch of the mandibular nerve, this one. This is the buccal nerve or the long buccal nerve. The long buccal nerve is another sensory branch of the mandibular nerve, but it is not involved in the innervation of the teeth. It supplies the mucosa of the inner side of the cheek as well as the skin over buccinator muscle. It doesn't supply the muscle itself, but it's sensory. For the skin, superficial to buccinator, mucous membrane, deep to buccinator muscle. It also participates in the innervation of the mandibular vestibular gingiva of the mandibular molars, but it doesn't supply the teeth themselves. Here in this diagram you can see the inferior alveolar nerve. This is the inferior alveolar nerve. Anterior to it is the lingual nerve. The lingual nerve is not involved in the supply of the teeth. Here is the inferior alveolar nerve passing into the mandibular foramen, into the mandibular canal, and you can see here it is closely related to the roots of the teeth. It supplies the teeth and then it sends this branch here, which is the mental nerve. So mental nerve, which is option D, is not related to the innervation of the teeth. It is the sensory innervation of the skin over the chin and the mucous membrane of the lips. This leaves us with the inferior alveolar nerve. The inferior alveolar nerve should be anesthetized in this patient because it is the nerve that supplies the mandibular teeth. This diagram summarizes the innervation of the teeth. The mandibular molar teeth, all of them are supplied by the inferior alveolar nerve and its incisive branch. After it gives the mental nerve, it supplies the incisive branch, which supplies the incisive teeth and canine. And then the maxillary teeth are not supplied by a single nerve, but they are supplied by three branches from the maxillary nerve. These are the posterior superior alveolar nerve, which supplies the maxillary molars, then the middle superior alveolar, which supplies the premolars, maxillary premolars, and then the anterior superior alveolar nerve, which supplies the maxillary incisive and canine teeth. Now returning back, just to show you the superior alveolar nerves, you can see here this is the posterior superior alveolar nerve. It's a branch of the maxillary nerve in the pterygopalatine fossa just before the nerve enters into the infraorbital groove, and then the maxillary nerve passes through the inferior orbital fissure, infraorbital groove, and supplies the middle superior alveolar nerve and the anterior superior alveolar nerve. These middle and anterior superior alveolar nerves also participate in the innervation of the mucosa of the maxillary sinus as well as supplying the maxillary teeth. In this patient, a single nerve block at the opening of the alveolar canal will result in blocking the mandibular teeth, including the second mandibular molar.